Anyone who has dealt with acute constipation or piles knows the physical discomfort is localized, severe, and dictates your entire day. When your digestive tract is backed up for days, it actively drains your energy. You carry a heavy, sluggish feeling around, accompanied by a thick cognitive brain fog. Caught in the middle of a painful flare-up, you face a tough choice. You desperately need fast, reliable relief, but you hesitate to rely on engineered chemical medicines to get your body working. For generations, the default solution has been traditional Ayurvedic powders. Things like Triphala or Kayam Churna serve as the baseline, natural approach to keeping your system moving. But prioritizing that gentle herbal relief often falls short when blockages get severe. You are eventually forced to choose between extending your daily discomfort or bringing in a stronger allopathic intervention. That brings us to Cremazine Plus syrup. This is the specific allopathic medical intervention we are evaluating today to handle those severe moments. Looking at the basic specifications, it is a sugar-free, mint-flavored liquid, and a 170 milliliter bottle runs for about 146 rupees. To understand if you should use this instead of a traditional powder, we have to map both options on a scale of time to relief versus systemic impact. This chart compares these methodologies. Traditional Ayurvedic churnas sit in the lower left. They take longer but place minimal stress on your body. Engineered syrups behave differently. They offer rapid, overnight speeds, but demand a much higher bodily toll. Choosing Cremazine Plus means you willingly trade the mildness of a daily herbal tonic for a highly effective medical tool, one that requires you to follow strict rules. To see why it requires those rules, we need to look at the exact chemical inputs that allow this syrup to work so quickly. The formula relies on a triple-action blend: milk of magnesia, liquid paraffin, and sodium picosulfate. This diagram illustrates the osmotic mechanism. Milk of magnesia and sodium picosulfate draw moisture from your body into the intestine. This water penetrates and softens the hardened material. Next, liquid paraffin coats the walls, creating a slick environment for everything to slide downward effortlessly. Creating this specific frictionless outcome is absolutely necessary for patients suffering from painful fissures or bleeding piles. Achieving this pain-free state means completely overriding your body's natural digestive signaling to force the system to flush itself. While this chemical override guarantees immediate relief for piles patients, that forced mechanism makes it entirely inappropriate for long-term daily dependency. Because the mechanism is so forceful, there are strict usage protocols you have to follow to avoid adverse side effects. The most common mistake people make is swallowing a dose immediately after finishing a heavy dinner. Instead, you must wait at least 2 hours after your last meal. If you eat at 9 p.m., hold off on the medicine until 11 p.m. Right as you are getting into bed, shake the bottle well and take exactly 2 spoons. Delaying your dose until bedtime precisely aligns the chemical's activation window with your morning wake cycle. This keeps the medicine working, preventing midnight discomfort. There is one major risk factor when taking an osmotic laxative like this: sudden, severe dehydration. Because the formula is rapidly pulling water into your gut, it is stealing that moisture from the rest of your body. The physiological consequences hit you the next morning. You can wake up with severe lethargy and a painfully dry mouth. To counter this, you have a strict, non-negotiable requirement to consume significantly higher amounts of water alongside the medication to replenish your systemic fluids. If you fail to manage your hydration protocol, you completely negate the energy-restoring benefits of clearing your stomach. You simply replace digestive discomfort with extreme dehydration fatigue. Beyond hydration, there are absolute disqualifiers and safety warnings for specific demographics. Pregnant women are strictly prohibited from using this syrup without explicit direct clearance from a physician due to the severe systemic fluid shifts it causes. There is also the dangerous practice of laxative stacking. This happens when users mix this allopathic syrup with their traditional nighttime churnas, hoping for an extra effect. Combining an osmotic syrup with herbal stimulants triggers extreme gastrointestinal distress and leads to a dangerous loss of electrolytes. When you utilize an engineered laxative, you must commit to that single methodology. Attempting to mix natural herbs with chemical drivers creates severe, unnecessary bodily trauma. Let's look at your actual symptoms to figure out exactly what you should buy. This decision tree maps out the routes. For mild, daily digestive maintenance, stick to traditional Ayurvedic options. If you suffer from acute piles, fissures, or severe blockages, the path leads to Cremazine Plus, provided you agree to the extra water rules. Diabetics dealing with those severe symptoms also align perfectly with this product, thanks to its sugar-free formulation. Cremazine Plus is not a daily wellness supplement. It is a highly effective, targeted medical tool. Keep it in your cabinet to strategically deploy only for severe flare-ups, and rely on Ayurveda for your baseline, long-term health.